Radiography, the hidden path to a rewarding medical career. Every year, thousands of bright students dream of studying medicine and surgery. Unfortunately, not everyone secures a spot. Admission is highly competitive, tuition is expensive, and the journey is long. But here's the big question. What if there was another way to still build a respected, impactful, and rewarding career in the medical field, without being a doctor or surgeon? That's where radiography, medical imaging science, comes in. What is radiography? Radiography is the medical science of using advanced imaging technologies, X-rays, CT scans, MRI, ultrasound, and nuclear medicine, to see inside the body. Radiographers, also called radiologic technologists, produce the images doctors rely on for diagnosis and treatment. Think of them as the eyes of medicine. Without radiographers, doctors would be working blind. Why consider radiography instead of medicine and surgery? Indispensable in healthcare, more than 80% of diagnoses depend on medical imaging. Rising demand, with increasing chronic illnesses, road accidents, and modern surgical procedures, radiographers are needed more than ever. Cutting-edge technology, work with powerful machines like MRI scanners and CT equipment. Room to specialize, diagnostic imaging, ultrasound, nuclear medicine, or even cancer therapy with radiation. Global career, radiographers are in high demand worldwide, offering both stability and international opportunities. Admission requirements. To study radiography in most universities, you'll need strong science background with credits in biology, physics, chemistry, English, and mathematics. Entrance exams or university screening tests, depending on the institution. Some schools may also test practical or problem-solving skills. Career opportunities. A radiography degree opens doors to careers such as 1. Diagnostic radiographer. Diagnostic radiographers are responsible for creating detailed images of the inside of the body using technologies such as X-rays, CT scans, and MRI. These images are critical in detecting fractures, tumors, infections, and internal injuries. Where they work: hospitals, diagnostic imaging centers, trauma units, and private clinics. Impact. Without diagnostic radiographers, doctors would lack the visual evidence needed for accurate diagnosis and treatment planning. 2. Therapeutic radiographer. These professionals specialize in radiation therapy for cancer patients. They work closely with oncologists to plan and deliver targeted radiation treatments, ensuring precision while minimizing damage to healthy tissue. They work in cancer treatment centers, oncology units in hospitals, and specialized radiation therapy clinics. Therapeutic radiographers play a direct role in saving and extending lives, offering both technical expertise and emotional support to patients undergoing treatment. 3. Ultrasound specialist, sonographer. Sonographers use ultrasound technology to create real-time images of internal organs, blood flow, and developing babies during pregnancy. Beyond maternity care, they assist in diagnosing heart conditions, liver diseases, and vascular problems. They work in hospitals, maternity clinics, cardiology labs, and outpatient diagnostic centers. Sonographers are often the first to detect life-changing conditions, from heart defects to prenatal complications. 4. Nuclear medicine technologist. These specialists use small amounts of radioactive materials, radiopharmaceuticals, to diagnose and treat diseases. They conduct specialized scans, such as PET and SPECT, which can detect cancers, heart disease, and neurological disorders. They work in nuclear medicine departments in hospitals, cancer research centers, and specialized diagnostic clinics. Their work enables early detection of diseases that are invisible through other imaging methods, improving survival and treatment outcomes. 5. Academic or researcher. Academic radiographers who pursue academia contribute by teaching and training future radiographers, while researchers focus on developing new imaging technologies, improving radiation safety, and advancing treatment methods. They work in universities, research institutes, government labs, and healthcare technology companies. They push the boundaries of imaging science, ensuring continuous innovation in healthcare. 6. NGO and public health roles. radiographers and NGOs and public health initiatives bring imaging services to underserved or rural communities, often where healthcare access is limited. They may also engage in health education and screening programs. They work in non-governmental organizations, public health campaigns, mobile imaging units, and humanitarian missions. They help close healthcare gaps by making diagnostic imaging accessible to populations that would otherwise go without. The job market. Radiographers enjoy high job security and are needed across hospitals, diagnostic centers, research labs, and global healthcare systems. In countries like the USA, UK, Canada, and Australia, the demand for radiographers continues to rise, making it one of the most future-proof careers in healthcare. Final note: why radiography? If you love science, technology, and working with people, radiography could be your golden ticket to a stable and fulfilling medical career. You don't need to be a doctor to save lives. Radiographers do it every day, often quietly but powerfully, behind the scenes. So if medicine and surgery feels out of reach, don't give up. Radiography may just be the alternative path that changes your life. If you gain any value from this content, show your support by giving it a thumbs up. Share the video with your friends, it helps us grow. And if you haven't already, hit that subscribe button to join our community for more exciting content.